Thanks, Jen. Pleased to be joined by Chief Nick Willard and Jack Wozmak, who is the New Hampshire's state drug czar. Your job is to oversee. Thank you both for being here. First, Mr. Wozmak, we'll start with you. Your job basically is to coordinate the state's effort, its response to this problem.
That's right.
You were kind of criticized early on over the summer. How are things going now?
I think they're going pretty well. I think we've had some good luck rolling out, obviously, 5,000 doses of Narcan. That begins to take some of the heat off while we improve access to treatment. You know, I've met with a lot of treatment providers. We've worked with a lot of local officials, a lot of state officials, a lot of federal officials. We've broken down all the silos every week. I meet with corrections and safety and education and insurance, health and human services to put a package together that's going to make this work. You know, I've met with treatment providers. It's really critical that one of the biggest stumbling blocks is they're not certain what's going to happen with Medicaid expansion, whether that's going to get reauthorized. I have facilities out there that are 100% Medicaid, which will simply close if Medicaid doesn't get reauthorized and there's no funds. I have other private providers, but it's really important that we make sure that we have an opportunity for reimbursing care through Medicaid.
Yeah, that's an issue that will come up in the legislature next year. But for you personally, again, going back to that heat that you were taking earlier in the year, you have, no question about it, a very difficult job coordinating this response. Are you confident that every resource that is currently available to you now in this heroin crisis is being used?
I am. Yeah, I have good relations with law enforcement. I've had good meetings with them. They understand what their job is. Their advice to me is work on prevention and treatment. We make the connections when we need to. Safety has been very important in focusing efforts and resources on prevention with Health and Human Services and other departments. And we've gone a long way towards getting more facilities licensed in terms of regulations and licensing and waivers and life safety.
You're talking about treatment facilities?
Yes, treatment facilities.
We're going to get to that in just a second. Let's talk about the law enforcement part of this. Chief Willard, you were obviously very frustrated over the summer, basically citing what you felt was a lack of urgency on the part of a lot of people at the state level and perhaps around the country not recognizing how serious a problem this is. Do you feel that things have improved?
Well, the recognition piece, the understanding piece has definitely improved greatly. There are more people at the table. We still need to bring more people in to the discussion, but the polls tell you that this is a serious issue that's touching pretty much every family in the state of New Hampshire on some level.
Communication was one of the key factors that you said that wasn't happening, and but Manchester Mayor Ted Gatsas says, yeah, communication is happening now, lots of talk, no action. Are you seeing enough action when it comes to outside the police force and other factors?
I'm seeing some level of action. Unfortunately, we're still beholden to, say, the legislature and the Senate to release funds on some level. So action is a lot slower than we would want it to be. But if those public officials come together and work on this issue as they would any other epidemic that we're faced with, I think we can bring about change. But that window is closing, and it's closing rather quickly.
What's happening out there on the streets right now? I mean, you see the poll numbers, and it's the #1 issue facing the state. A lot of people know someone who uses. What's happening out there? What's
happening is those individuals who are addicted to drugs, that pool of people is growing. It's growing at an alarming rate, and we need to somehow shrink that. We are affecting the supply to a great demand. We are locking up drug dealers at an unprecedented rate, 30 in the past 2 weeks on my new initiative. So the supply is there. We're affecting the supply, but the only way to truly affect some sort of change is to shrink the addiction pool. And that isn't something I can't do because I cannot arrest my way out of this.
Right.
I can certainly arrest as many drug dealers as I can get my hands on. But that pool of those who are addicted, that needs to shrink.
Let me ask you, Chief, a lot of this is being blamed, so the heroin epidemic is fueled by the abuse of prescription drugs. Is that the overriding delivery of these addicts, or are we seeing people who never done the pills before, but there's so much heroin on the streets right now that they're getting addicted that way?
I don't believe there's that demographic. I mean, you always have that underlying mental illness where people are self-medicating by abusing drugs. But when we say people are abusing prescription drugs, I think the medical profession is over-prescribing prescription drugs. So it's not necessarily people abusing it. If a doctor is willing to give you prescription drugs like they're candy, and you feel it's okay to take them, not realizing the true addictive nature of what the doctor is giving you. There's this contradiction that you have such faith in a doctor that they know what they're doing. So when they're prescribing you something that's highly addictive without your true understanding of how addictive it is, well, I think there's a level of negligence there. So I put it on the medical profession just as much as I do as anybody else.
Unfortunately, there's no one here from the medical profession to
Well,
weigh
bring
in
them
on
in.
this, but they are certainly part of this discussion. Jack, back to you. When it comes to treatment, you have so many people that are going into Manchester's mayor's office or calling whoever they can saying, I need help and I can't find it. Why is that?
Right. Well, I think that we just need to do a better job at making sure that people understand. We do have nhtreatment.org. There are websites out there where you can see a list, put in your zip code, and you can find treatment. I've spoken to treatment providers who have available beds. And so we may not have all the treatment we'd like to have, but we have available treatment. And by using New Hampshire nhtreatment.org or the Anyone, Anytime NH website, that link, there's a ton of information there. It links you to lists of resources, and it's easier to find a bed.
Someone, for someone who's desperate and addicted, being sent to a website and navigate, some of the government. Let me ask you: are you confident
It's very
that
easy to use the website?
Are you confident that if someone who's seeing this tonight, perhaps, says, you know what, this gives me the courage to ask for help, that if they do, they'll be able to get it tonight?
I do.
And by going on this website, there's a number that they can call.
They put in their zip code, and they can see the treatment providers in the neighborhood. There's names, there's addresses, telephone numbers. They can start calling. It's not as easy having your appendix out, but it is easy to use. It is very friendly. It maps every service in the state of New Hampshire. And there's a lot of service providers. I understand that it is important that we make it easier to access them, but this nhtreatment.org and the Drug Free New Hampshire website has a ton of information that will help people navigate the system.
One more question for you. Are you comfortable with the level of recognition this problem has when it comes to the federal government? Because we talk about this coming to the streets. It's not being grown and manufactured here. It's coming from somewhere.
I've had as much interaction with our congressional delegation in Washington and indeed the White House as I have with any of the local department officials. So they are all in.
And I'll end this discussion with you. Federal law enforcement agencies, good coordination there?
Oh, outstanding coordination. We're going to be conducting a task force with DEA, FBI, the U.S. Attorney's Office, and we're going to be going after the drug cartels that are fueling the drugs into New England.
Well, you both certainly have very difficult jobs. We appreciate your efforts, and we certainly do appreciate your time tonight. Thank you very much.
Okay, thank you.
Good to see you. All right, this is, about that beard on Chief Willard, I want to point out that's part of a fundraiser he's doing on the part of the Children Advocacy Center, in case you're wondering about that.
Thank you.
Another good cause on top of things. But this, obviously, the heroin issue is not one that's going to be solved quickly. For the continuing coverage of the heroin crisis and the efforts that are now underway to stop it, stay with WMUR on air and online. Follow us on Facebook and on Twitter. And send us your stories as well and the things that you have learned that could help stem the spread of what has certainly become a very dangerous and deadly drug.